Now, there's three components to kind of rejuvenation of the tummy. There's the muscle wall. Is it stretched? Okay, when women have kids, you have the six-pack muscles on either side. And what can happen with pregnancy is this little tendon in between, which is usually very thin, can spread. And so when you sit up or you activate your muscles, you'll have a lump that comes up in the middle. That's called diastasis. And that's an important part of the evaluation. I don't know that you have a whole lot of that going on. Mm-hmm. So let's just, now the reason why I bring that up is because that puts you into the tummy, abdominoplasty, full tummy tuck procedure, which is the kind of the big one that we do. It's under general anesthetic, but that is what we do to tighten those muscles back together with sutures. We have then the fat layer and then the skin. Okay, so that can be addressed with liposuction and with skin removing procedures to help get things tighter. What's nice about doing the liposuction is that it can be done with some pills and local, so you don't have to go to sleep. What we generally would do in this situation here is do liposuction to begin with, okay? And that is done by the anesthesia in liposuction, like I said, is local. And what we would do is fill up this layer, the fat layer, with a bunch of fluid. In that fluid is lidocaine, which is the nerve blocker, and epinephrine, which helps us with bleeding, and it helps make the lidocaine last 6 hours. So we would pump this layer up and then wait 30 minutes, and it gets numb. It's kind of like the dentist. You can feel what you're doing as far as pushing and pulling, but there's no pain, okay? There's a little pinchiness getting numbed, but you know, the pain is just something you shouldn't expect to endure at all. So once it's numb, we do the fat removal, and then we're looking at what do we do with the last component, which is the skin. We talked about the muscle, now we've addressed the fat layer, and now we're gonna talk about the skin. And there is some what we call laxity. You know, there's been kids. We do a mini version with a lot of patients where there's a C-section scar. They have a small area that hangs over, and that can be, if that's really the only loose part of the tummy, that can be dealt with by just taking some skin from below, okay? You can do a mini tuck. A mini tuck, this is right after the liposuction. The skin is numb, we can just take it, you don't feel anything. But if you have any laxity above the belly button here, we're tethered by this belly button, and the skin can just kind of hang over top. In those cases, it's possible, then we have to release the skin around the belly button so we can pull the skin over top and get further tightening of the upper abdominal skin. And so that's an option too. And then wherever the skin pulls over, we bring the belly button through, it stays attached, and we make a pretty nice little belly button, a new one. It's not your own necessarily, it's created by us, but it can look very nice if we do a good job, take our time making a small, natural-looking belly button. But that allows us then to get tightening of the upper skin, because in some cases we'll have, if we just do tightening down here, it'll be a little loose up here, but tight down here, there's a disconnect. So that's all very possible, and I think you would be a candidate for that. Commonly, the midsection has a cosmetic unit, goes around, and in this case, we would want to recommend or consider liposuction of the hip or the love handles, whatever you want to call them. And I think I'll just go ahead and do some markings here to demonstrate, you know, where those areas are. Just a little bit further down there. Now, if I could have you just turn around for me. Keep going. Good. Hands like this. Okay, so here's the upper, lower tummy going into what we call the mons pubis. All those three areas. Here's where we transition from the tummy area into what we would call the hip and waist. And this is the hip going into the waist, which goes up into this, what we call a bra roll. And so that would take care of from here to here. We would fade into the bra roll, fade into the bottom, and that takes care of the sides, upper lower tummy, skin incision. Now for the scar, it will be hip to hip to get the skin out and have it lay flat. But the scar would be under the underwear line, tapering up into the waistline there. So those are kind of the areas that we treat commonly.